My name's Matt Fry. I'm the operations manager here with Cornerstone Senior Marketing. And if I haven't had the pleasure of talking with you individually one-on-one, I look forward to the day that we can. But I really also appreciate your taking the time out of your Friday morning to join me today to learn a little bit more about Medicare Center. Specifically, what we're going to do today is this is going to be less of a Medicare Center training as it is more of a highlight of what is coming for 2022. And ultimately, just letting you kind of get a feel for what this site's going to look like when you log in on October 1st. So if you guys have questions, I mentioned this just a moment ago, but I'll mention it again. If you have questions, I want this to kind of be an open forum. I will keep an eye on the chat and Q&A. If you have a question, just put something out there, and I will be more than happy to stop what I'm doing and kind of circle the wagons and answer the questions that you guys have out there. So thanks again for joining me, and let's just dive right in. So the first thing I want to talk to you about is that, in years past, specifically last year, we launched this Medicare Center initial sign-on, where it was basically a one-stop shop sign-on to be able to launch and access multiple new platforms inside of the tool. If you've really been with Medicare Center over the years since we've had it, you know that Medicare Center was just one tool there for a number of years up until last year. And last year, if you were, regardless if you had used the Medicare Center tool in the past, we had to make you register for Medicare Center again. Well, the good news is that everything is being updated through the launch icons, basically, inside of Medicare Center, which I'll show you here in a moment. But you do not have to re-register. So if you're currently a Medicare Center user, you do not need to register. You will be able to continue to access this tool from the devices that you're currently accessing it on, as well as multiple different browsers it is compatible with. Right now I'm in Firefox, but and that's just what I use. But we have a lot of users that use Chrome, Safari, Edge. It's all compatible, so that's the good thing. But if you are new to the tool, you will have to go out here, and when you go to MedicareCenter.com, which is how you access these tools, just www.MedicareCenter.com, you will have to click on this registration link to get started. But I'm going to go ahead and log in here. Now, I want to start by talking a little bit about the Learning Center. So the Learning Center, if you guys have never really came out here in the past, this is a place where we kind of house some helpful information and things like that. We have guides, specifically tech guides in the tech guide section. We have some sales tips things, working remote, some carrier solutions and products. I wanted you to know that we're kind of revamping this year. We will still have some tech guides that made available to you, but we are kind of trying to pull together resources, make information available from the carriers out here at your convenience. And specifically, we're going to add some more video trainings because it seems like more people are more apt to watch those than just pulling up a PDF. So we will be, really enhancing this, the Learning Center portion of Medicare Center for 2022. And everything, I mentioned it just briefly a moment ago, but everything that I'm going to talk about here today will go live on 10/1 of 2021. So because we're talking changes to the tool for the upcoming plan year for plan year 2022 and AEP 2022, we're going to be showing you those new upcoming plan benefits starting 10/1. So we're going to be launching everything on that date. So just keep that in mind. Now, I'm going to stop sharing just briefly because I want to pull up something different here. And I want to share this screen right here. Sorry, I had the chat boxes on here for you. I'm going to skip past some things. So I don't actually have a working sandbox environment that I'm able to log into yet to really show everyone around on, or that I can do that yet with. But what I have been given is this presentation. So the biggest change that I will tell everyone that is coming for AEP of 2022 is changes to the client management system. So I'm not sure if you guys are using that CRM or client relationship manager tool yet, but we do have a lot of good features in there. And as soon as I get through what's coming for AEP, I'll jump back in and show you what it looks like here today if you were to log in. But really, this is a free online platform for you to be able to put your client's information in, disposition your clients in regards to where they're at in the sales, whether they're prospects, whether they're clients, and just another place for you to add information, tasks. And then here's kind of what's coming for this upcoming AEP. So when you first log into Medicare Center, this is what's going to, this image on the right is really what we're being told it's going to kind of look like. So from today, we still have those three little buttons to launch either Medicare Advantage and PDP, where we have to make a selection, whether we're going to go out to Medicare Link or Medicare App. We have that Medicare Supplement button that will launch out to CSG. And then we also have the client management tool that I was talking to you about. Those are the three little white buttons that's out on Medicare Center if you log in today. However, we're going to be changing up a little bit. We're adding some agent personalization. That where it says "Good morning, Rachel," that's going to have your information. You'll still be able up here in the right-hand corner, be able to make changes if you needed to under your profile for Medicare Center. We're just really doing that to just give it a more personalized experience as you go through it, as well as we're going to have a site-wide notification bar to allow for hopefully ease of access for announcements and more when we have updates to the tool. So you can kind of see there, right there, we're going to kind of give a preview where we're going to have some training videos that you'll have access to on demand when you log into the tool starting 10/1. And then we'll have basically a homepage feature bar to capture, the agent's attention, if there's any time-sensitive events or things that we need to pass along to you. But the biggest thing that you'll see here, if you look at that image on the right, is this new dashboard. So this is basically, we are going to be making a lot of changes to this client management tool for this year, and I fully anticipate for years to come as well, because one of the things that we've heard from our agents that have been using some of the tools is they wanted some more reporting functionality. They wanted a little bit more, of a CRM, and the CRM that we were offering last year. If you put clients' information in the Connector tool, for example, Medicare App, it wasn't automatically, showing up in your client management tool. So there was duplication of efforts there. And really, you kind of wanted a good place to house all of your client information, especially for those agents that don't really have their own CRM solutions up to this date. So, we're adding a lot of information here, but you'll see here, you'll be able to launch Medicare Link, Medicare App, and the CSG tools right from the homepage, as well as click into to view this dashboard where you'll be able to, as I go through here, talk about some of the things that are coming to client management. So really, you have the ability to, as I mentioned, to go out to the client management tool today, add clients. You are even able to import clients into this tool, and I can show you that here in a moment as well, live on the site. But like I mentioned, I wanted to kind of talk through some of the new things that were coming. And really, but all you're able to add out there today is demographic information on your clients, as well as so just dispositioning them in regards to where they're at in the stage of the sale, whether they're new, whether you've sent them the scope of appointment, whether they're enrolled, whether you sent them a quote, those sorts of things. And then you're able to add preferences in regards to how that they like to be contacted. However, for AEP this upcoming year, we're expanding on this because ultimately this client management tool, the biggest change to it is that we're going to be adding another option for you in regards to quoting and enrollment. So you're not only going to be able to house your customer information inside of our client management, you're going to be able to kickstart the quote and enrollment process all from that tool. Now, you're going to see here on the right that we can add providers, we can add prescriptions, we can add pharmacies. A lot of that information is already able to be added in some of our other tools like Medicare app. But just know that you're also going to be able to have it out here. So it's going to give you another place to kind of digitally save that information year over year underneath your client's profile, and give you the ability to select and store, like I said, pharmacy provider information, and just really allow you to quickly access available plans, based on those preferences. And for those, I'm sure that this question was coming. I will tell you this right now. I know that the bulk of our agents are using Medicare app, which is where I'll spend a decent number of my time here today going, later in the training, going over some of the updates that are already actually live for this upcoming AEP. But I will tell you that it is our intent. I haven't gotten final confirmation on this, but it is the intent. If you have client information under the Connecture Medicare app tool, that we are going to try to preload this client management section with that client data that's already in Connecture. Because ultimately, this new client management quoting and enrollment process is going to be using the Connecture API, which is kind of like they're using some of the Connecture tools and resources behind the scenes, but we're just kind of making it unique through the client management tool. So you're going to see a lot of similarities between Medicare app and the way that this new quoting and enrollment platform work. But it's our intent to already preload this tool with your client information if you have it in Medicare app today. So you'll have the option to still use Medicare app if that's your preferred method for quoting and enrollment. But we know that in order for you guys to want to use this new tool or to explore kind of what's out here in regards to the client management aspect and the reporting functionality that I'm getting ready to talk about, that you want that information that you've already added to these tools to be available day one. So we're working on that. Once I have final confirmation, I hope to be able to share that confirmation with everyone in a later training, because I am doing these things all throughout the month of September. So along with being able to add information in regards to their preferences, their current drugs, their providers, their pharmacies, etc., we, through this platform, are just going to give you another option for how to capture electronic scope of appointments. So you will be able, from this tool as well, be able to track and manage for compliance all of those scope of appointments for your members. So it'll have both history and current SOA details for you, the agent, and simple ways to really, store these and track these and provide them to your members. You can see over there on the right, we are going to, just like the Medicare app tool, as I mentioned, you'll see a lot of similarities, but you'll be able to email it or text it to them, and it'll be pretty generic and pretty easy thing to complete. So once I get access to the full site, basically for the sandbox environment, I'll be sharing some of these things and going through these processes live, hopefully later this month in September in a later training. But so from that client management tool, you're gonna be able to enter in, import, or have your client information, store their preferences, capture their scope of appointment, and then ultimately kind of launch into a quoting platform and process. So you can kind of see here there's a lot of information that's similar to on the look of things. And I will preface this by saying that these are preliminary screenshots. So when you get in here, 10/1, it might look just a little bit different, but it's going to have the ultimately like this, this feel. So, you're going to have your navies, your blues, your whites like this, the ability to see plan details, compare plans. You'll have some information at a glance on all these carriers with, filters over here on the right, and, different abilities on how you can kind of sort those plans. And then after you click into the plan details, you'll see here, we're going to give you a lot of that same information that's available, as I mentioned, in today's, Medicare app tool, where you can find, information on, how things are going to be covered, throughout the months, and especially with your prescriptions. But, the bullet points here, you'll have, like I just kind of went through all that stuff, but you'll have access to contact details. You'll be able to sort and filter. You're going to automatically be able to, your preferences will pull through from the CRM client management aspect. So if you have preferences on their client record, it's going to automatically come in and over. You're going to be able to access all those plan details, as I mentioned, and then move straight into from the profile into this quote, and then ultimately into the enrollment. Now, after you've done the enrollment, one of the things that I know we have such good tools that you're able to access from Medicare Center today. However, one of the things that I get questions a lot on is, especially post AEP, is, how can I maybe run a report on, the members that I enrolled over the course of AEP, or, what all members did, I actually enroll, or, what happened through the tool. And the only real way, if you're using Medicare app, for example, to pull that report today, is there's a section there on the search beneficiaries page where you can put in application start dates and end dates, and then pull that report based on the time window that you added in there. And so there's some information that can be garnered and pulled from Medicare app, but really we want to enhance your visibility into your client profiles and the enrollments that you sent through. So that's why we're adding this dashboard. So you're going to be able to see at a glance all of your recent activity. You're going to be able to pull some reporting out of this tool, and really just, you can kind of see over here at the left, you can kind of see, how many you've quoted, how many have applied, how many of them have enrolled, how many scopes of appointments you've sent, that sort of thing. And, as it points out over here, it's going to show agents your top level stats and activity, including your ability to kind of quickly jump to that next action, whether you want to view that quote that you ran for, this person, or, that sort of thing, or, come in here and, even change some of the filters on here. So I did have my first question that came in. So, Medicare buyback should be available on initial benefit coverage without having to drill down into the benefit summary. Medicare buyback. You're talking about the Part B give back. I'm sorry. Is that what you're saying on for some of these plans, Steve? Okay, gotcha. So that is good feedback. Like I said, a lot of this stuff is not yet live, so I can try to make those suggestions. Honestly, I don't know. Inside of Medicare app specifically, some of that information, if that's going to change, but you're right. At least right now, today, that information, you do have to drill down into the benefit summaries. But that is quality feedback, and I will absolutely take that to my Medicare Center team to see if that's something that we can enhance. And that's the kind of open feedback that I encourage, and that I hope that you've heard from me in the past, mention to you guys. I really, if you've been using this tool year over year, you've seen a lot of the stuff that you guys have told us. We listen, and we do try to put in solutions for these things. So it's really important, especially post AEP, if you kept running into things, or you ran into frustrations, or you needed, something, you want to see something in the system for future years, that now's that time to tell me that information so that we can get it implemented, for the upcoming plan years. And that's really it. That's the end of the slideshow anyway. So why don't I'm just going to, once again here, stop sharing and then go back over to the live site here, because I am not quite done with everything, but I do want to kind of go back through some things. So, the client management tool is, as I mentioned, just really where we're going to see the bulk of the changes and updates to this tool on Medicare Center for 2022. But, inside of this client management today, you already have the ability to add clients. You have the ability to import. We are working on the ability to export contact and information out of this tool as well. I know that that's on basically our agenda to get done. Now, I probably won't be live here for 10/1 or maybe anytime that soon, but it is something that is coming. I know that for sure. But when you come out here, it'll kind of default into this list view. If you prefer more of a business card view, you can do that. But here are those stages that I kind of talked about, how you can, basically, put in where a client is in the sales process so that you can kind of track that. And then you're actually able to kind of sort by, some of those stages if you needed to. You can set reminders for certain members. Once we click in and add things, right now, if you come out here, you're only going to see these reminders, activity, and client notes. However, as I mentioned, this is where you're going to be able to, start to kind of add in some of those other preferences, like the drugs and the providers and your preferred pharmacies and that sort of thing. And then under your preferences today is where you can indicate certain communication preferences for your client. So that's the client management tool. I definitely wanted to give that the bulk of the early part of this training, so that we could really talk about some of those biggest changes that are coming. Now, I will also tell you that we've already made some. I don't know how many of you that are on today's training that were also attending the road show and maybe listened and watched my presentation that I did for the road show. But a lot of the rest of what today's training is going to be kind of covering on some of those things that I mentioned on there that are already live. So, I'm going to start with CSG really quickly. And if I launch that, you may have noticed over the course of the last year, if you use CSG, that you've seen some changes and updates in regards to the tools that are available to you. So, and I know that Cornerstone has had an affiliation with CSG for years. And so some of you may have even been using it for a very long time, and you still have that old link that we maybe provided you, and you're accessing it maybe through something else. But you can access CSG through Medicare Center. And because CSG is actually now a firm partner with Cornerstone, meaning they are a part of Integrity Marketing Group, they have made all of their tools available to our agents. So that includes some of the new things like this Market Pulse, which we never had access to here recently. It's basically a carrier marketing library and a good place for you to look at document information on carriers that maybe you're not appointed with. We've earlier this year, we added that Medicare Edge tool. We did a little bit of a snapshot on that earlier in the year about what all you can do in this tool. But it's a great place if you're looking to maybe market into new areas of your state, or you're looking for prospects and things like that. You can actually find Medicare eligible information inside of this tool, as well as really do price comparisons between companies. It's a great little feature where we give you the option and ability to capture scope of appointments all over Medicare Center. I already talked about how that was coming under that client management tool, but you can also even do it now in CSG. So if you're already working in and out of CSG a lot, there's an electronic scope of appointment document signing process that you can use. It's pretty easy. You can even use it face-to-face, which is nice. And then also new is this client manager tool, which I think is a great little addition. Not only can you import clients into this platform as well, but you can just manually add clients. And it's not a hard thing to do. You can kind of see out here, there's not a lot to add. All this information is basically optional, whether you do or do not include it. So we don't need any of that other stuff. But really what this gives you the opportunity to do is, keep track of the of your quote history inside of CSG. That was some feedback that we got from our agents, was that, hey, I ran a quote for my member. I printed out the PDF, the side-by-side copy of all the Medicare supplement plans that I quoted the member, but now they want to go back in and re-review, and I have to recreate the wheel. Is there any way around that? Well, now you can. So if you create a quote underneath somebody that you just created inside of this client manager tool, you're going to have a quote history out here, and you're actually going to be able to pull up that quote at a later time. And you can click that new quote from up here, or if they're enrolled, it'll even show you current products that they're in, or you can just start that process of diving right into to any of these. And then you can see here their information's already applied up here at the top in regards to the application or the client information, so that their name will appear on any of the PDFs or handouts that you're able to put together through this system. And if you weren't aware, this is still my preferred tool, and I'll talk a little bit more about some expansions on Medicare supplement quotings and things like that here in a moment. But this is still by far and away my tool that I would recommend to you to use if you're quoting Medicare supplements. I mean, it's going to have everything out here on the platform, and not only, all carriers, regardless of your contracting, so that you really know what's out there. And not only that, you can add inside of this tool, you can add health conditions and medications in here to get an idea of what carriers may take your client. There's not a lot of tools that are out there for Medicare supplement quoting that allows you to do that. So just keep that in mind, and all I had to do is, click that, those advanced options to kind of pull up those underwriting filters. And if you've never seen this here before, we have information at a snapshot. We also have, you can find under market analytics, you can find increase history, how long have they been in the market, any sort of age increases as your client would age up. And it's really easy to really, kind of compare these things. All you have to do is just kind of click these banners here. You can see here we have some carriers out here that you can even electronically enroll through the system. The newest one, a new addition to that, is United Healthcare. The AARP Medicare supplements you can quote and enroll through Medicare or through CSG. Excuse me. And Mutual of Omaha and Aetna Supplemental are already two other big name carriers that you could do that on. So, we're really, starting to give you some options in regards to electronic enrollments for your med subs as well. So that's great. But as we kind of put these things together, you can compare up to 5 plans here. There's a universal comparison option if we're, pulling in maybe different things just besides just med subs. If we want to pull in hospital indemnity or, final expense quotes or dental and vision, you can add those all to a universal comparison quote. As we pull these things up, side by side on a comparison, this is really what you can, provide your members. And if you click this PDF, it'll basically convert these things over to a PDF in which you can share with your clients. And then now, if we go back to our client manager tool, click on the member, you can see here that we started a quote today, and all we have to do is click that run quote to dive right back into where we left off. So a nice addition. So if you're using CSG today, I encourage you to go out there and also maybe use the client manager tool here so that you can keep track of your quote histories for all of your members. So with that, I'm not going to go through something on each one of these. Like I said, I didn't want this to be turned into kind of a training option on how you use, all of these tools. I still encourage some of the other tools a little bit more than I do CSG for your quoting of Medicare Advantage and PDP, just because there's not a lot of information you can add into this tool yet up front to get the most accurate quote. But where you can use this very effectively is if you work in that ancillary market and you sell hospital indemnity and you use one of our other tools to maybe enroll your member into a Medicare Advantage plan for 2022, you can actually come out here, run that quote, find that plan, and then there's an option out here underneath after you have your plan selected to be able to fill the gaps, with that hospital indemnity, which is a very powerful tool when you're quoting, for your member. You can really show them how you can, stop, the cost exposures year over year. So let me find a good plan here. So we'll just use this regional PPO. I'll click compare quotes. You can kind of see up here, there is now an option under this Medicare Advantage and PDP quote to just do that, fill the gaps. It's going to pull information on your member. You can choose the hospital indemnity plan that you want to look at and pull in for and shop. And now you can kind of see here we have a running total up here out to the right. We have our Humana Medicare Advantage plan we enrolled our member in, and then now over here on the right we have our hospital indemnity. So maybe we want to cover that $270 copay for them for riding in an ambulance. Maybe we need to cover that, that $90 copay for emergency room visits. Maybe we need to, cover that skilled nursing facilities days 1 through 20. You can do all that. It's going to continue to add to that total, and then you'll be able to tell them, okay, well, for $1537, really look at what I'm covering here for you on top of this $0 plan. So if you're not selling ancillary things like hospital indemnity, like final expense, the dental and vision, I encourage you to just kind of come out here and play around inside of CSG, get comfortable with those quotes, and then start to have those conversations with your members. Especially, that's a great place to be able to circle back up with your clients after AEP. So now that I kind of went through that Medicare supplement and the client management, we talked about the Learning Center. I am going to take some time to also talk about our current Medicare Advantage and quoting tools that we have available. I'm going to spend the bulk of my time in here today talking about Medicare app, simply for the fact that almost 95% of our agents that are using the Medicare Center for enrollments, really, for at least on Cornerstone's perspective, are using Medicare app. So if you use Medicare Link and you have questions on that tool, I would say throw them up in the Q&A in the chat, and I will try to answer them as best as I can. But I want to talk to you about Medicare app because over the last 6 months or so, we've slowly been rolling out changes to the tool. Most of you, if you're using this platform, you've probably already caught them, but I do want to talk to you about them. So, the first thing that we just recently added, this was our newest feature that we updated, is under your account overview, and this, if you remember, this will be your information when you log in, but if you click the account overview, this is where you can find that My Shopping link or that personalized URL. A lot of our agents are using this personalized URL for their websites, for their social media, for their email signatures. That new quoting and enrollment tool through the client management, I'm being told, is not going to have a Pearl available for this AEP. So if you use something for your website, I would still strongly encourage you to use this Medicare app, My Shopping link, and all you have to do is click this copy link, and then you can use that link to provide it to your members. And your members, it's a consumer-facing site that your members can quote and enroll themselves without you guys ever having to do anything. They can even create an account and put in their drugs and put in their providers, put in all of their preferences, and that information can carry over into your agent session of Medicare app so that you don't have to manually key that in. It's coming from information that they've added. So it's a very powerful tool, but I will also, it's always important for me to tell you that this Pearl does change for new plan years. And it also needs to get updated when your permissions are updated, because your Pearl will only be added with your current active selling permissions. So if you are not ready to sell yet, I strongly encourage you, strongly encourage you to go out there and get certified like today or over the weekend or very soon, because we're going to start to add those 2022 selling permissions to this plan, or sorry, to these tools. You won't see them until 10/1, but we're starting that process here over about the next week and a half. And we want those 2022 permissions to be loaded up day one. But if you need to check to see what all states are showing up, what all plans are showing up, what all carriers are showing up, and for what plan year, we now have a filter out here where you can, start to look at those things or pull filters, based on states, based on carriers, to see what all available has been loaded up for you. I don't have a ton up here uploaded, but so it's easy for me to look at things at a glance, but for most of you, that's not the case. So go out there, get your selling permissions added, and if you do, maybe let's just say Anthem late, you do your certification late, but all of your other 2022 selling permissions are loaded up 10/1, and you come grab this personalized URL shopping link. After you completed your Anthem certifications and that selling permission gets loaded up for 2022, you're going to want to update that link again. So come 10/1, if you're currently using that My Shopping link on any of your social media devices or websites, please update that so your members will see the 2022 options, okay? Now, the next thing that I'm going to go over is some things and updates that we've made inside of certain profiles, or inside of the profiles after you've created a profile for your member. All right, so there's nothing really new on this page that I need to really talk to you about, but the first thing that I want to talk to you about, I skipped right over it. I do want to show you something here. I apologize. Before I move forward and start talking about some of the updates to our preferences. If for whatever reason you needed to export information out of Connecture, we do now have the option to do that. We didn't before. You can see up here there is a link to download results. So if I was talking to you guys about how you can use those application start date and end dates to find all your enrollments. If you did after post AEP, if you wanted to run those results to figure out who all you enrolled, and you want to download the results from those profiles, you can search 10/15/2021 to 12/7/2021 and download those results. Click that; it'll open it up, all that information up into Excel. So it's a nice little new feature that we've added. The next thing I want to talk to you about is preferences. So, up until here recently, we had only the option to add prescriptions, pharmacy, and some health preferences in there. But you guys, I'm sure, have all noticed that Connecture, which is the company that powers Medicare app, they recently rolled out the new provider searches. So you do have the ability to to search for providers out here and add providers to the tool. I'll tell you, I've been getting a lot of questions on this. We do get this information directly from the carriers, or they are required to send like a direct feed basically from their network information to Connecture for us to tie into. So I know that I've talked with you about some of the things that you guys are seeing out here, or frustrations you might have been seeing, but we're getting this information directly from the carriers. So, we're only as good as what they are telling us, but as you guys know, and even especially around this time, networks can change, especially year over year. So just know that, and, know that, we still encourage, personally, I encourage you, if you have concerns over what providers you think may or may not be in network, the best thing to do is to still go directly out to the carrier to find that answer, simply for the fact that, they get that information first before they filter it down to everybody else that uses their tools and uses their feeds. So just keep that in mind. The other thing that I noticed that, people have been asking me, some of them, have been having problems finding certain facilities. I encourage you, if you're searching, to really use these tools to, if you're looking for hospitals and things like that, to take out those doctors and other professionals, because if you do that, it'll only bring up the healthcare facilities. So your hospitals, your urgent cares, that sort of thing. And it's also important to note that, they're in here based on their actual name. So if, for instance, here locally here in Columbus, I know not everybody's here kind of where I'm calling from, but one of our hospital networks is Ohio Health. Well, some of their facilities are named like Ohio Health Grant Medical Facility or something like that. If you just search Grant, it might not come up right away. So you want to add that Ohio Health in front of it. So just know that when you're searching these things, and keep an eye on locations as well, because most of providers work out of multiple locations a lot of times, and they may be in for one location but not for another. So if you're making the wrong selection on address, that might throw off the results when you finally get to the provider page. And if you needed to pull in additional information, keep in mind that you can use these kind of pluses or minuses on the map view to kind of narrow your searches or expand your searches. And now if you expand it, you do have to, after you hit that button, click this option to search this area. Now there was no additional Grady's out there, but that would have pulled in other Grady's. And that works on the pharmacy map as well. I know some of you guys in the past have called me asking me about, a pharmacy not showing up in your initial results based on a zip code, because maybe they travel pretty far to get to that pharmacy, or the network search for that pharmacy only goes out so far. Well, you can use that expansion, search that area to pull in more pharmacies. So let me just show you what that looks like here. All right, yep, and we see we went up in number there. So, okay, but that's kind of the how to use that map expansion search. Under the prescriptions, it's still out here. I'm not sure how many of you used it last year, but we do also have the ability to use that, connect that mymedicare.gov to pull in prescription information directly from CMS. So if you guys have clients with a mymedicare.gov profile, you can send an email to them, and then your member, sorry, I should have had this up here. Is going to get an email from the system with your information down here at the bottom, asking that client to allow Connexure to download those prescriptions. So that's if you have somebody that has a mymedicare.gov profile and they take a ton of drugs, that's going to save you a lot of time. If you send them this email, they'll be prompted to log directly in to that mymedicare.gov site, and it's going to take them, I don't have a login unfortunately, but it would take them right out to that tool where it asks them, will you allow Connexure access to your prescription information? If they grant that access, this will start to say access granted. It'll start to spin, and then all those prescription drugs will pull in. All right. Now, The last things, couple things here that I'm going to talk about on Medicare app is in regards to these plan pages and just really the text, email, quotes, and enrollments. Just as we get ready for and get closer to AEP. So, if you add multiple pharmacies, you guys probably noticed you can jump around here now on the pharmacy to update your cost, per drugs, based on, how things are covered. We've also added new filters like this insulin savings programs over here off to the left. So if you have people on insulin medication and you only want to view plans in which are part of that insulin savings program, you can check mark that filter to kind of pull that in. We've removed the SNP plans from the initial results. So if you work in that chronic or dual market, you do have to click this link to add all special needs plans to your results. We also have the ability to add in all non-licensed plans. So if you're not currently contracted with Cornerstone with a carrier or something like that, but you still want to make sure that you're looking to see what everything that's out there in the market space, you can click that link and it's going to pull in all available carrier plans that are available inside of that zip code for your member. And I'll do that just now so that you guys can see what that kind of looks like. You'll see how these plan options greatly expand. You'll notice here too that Medicare Supplement jumped from 0 to 14. We have added some plans for quoting only, not enrollment, for quoting Medicare Supplement out here on Medicare app. I believe that is going to be expanded a little bit for for AEP, but I have not gotten final confirmation on all the carriers that are going to be added. I do know that from a Medicare Advantage standpoint that we were working very hard, and it's my understanding that both Devoted Health as well as SumaCare are going to be added to this platform for 2022, which is great news. Because those are obviously two carrier partners of Cornerstones that we wanted to make sure that were available on this tool for you for enrollment. The next thing I will talk to you about, we added the ability to throw in the provider information. Most of those that I added were Ohio Health, which is why they're not showing up here in Network for Medical, but you can kind of see that at a glance, we can see those providers if they are or are not in network. And then under plan details, we have further information in regards to some of that provider data. This is under plan details, all that plan information down there, and then you can kind of get more of a breakout of who is or is not out of network instead of just that full number. Okay. Also on the total cost tab, a little bit newer this year, it's not quite new now, but it was added, is the ability to update that effective date. So if you go into plan details on any plan, go over here to the total cost tab, you can update that effective date for your members. So a great little tool there. I'll also mention that for the longest time there, it was kind of, when we first launched the ability to text things to members last year. I don't know how many of you caught this, but we could text scope of appointments to members. We could email them scope of appointments, obviously, as well. Or we added last year the ability for you guys to pre-complete an application or an enrollment for a member and then email it or text it to them. But for when we first launched this, for whatever reason, the quote was only still allowing emails. But now that did change. You can come out here, and if you're just sending a quote to a member, you can text it to them. And just to keep in mind, here's that, a place where you can, customize the message if you're sending a quote. You can change your pharmacy from this view as well, so that they see that pharmacy on when they first log in to access that quote. And then you can select some plan benefits if the carrier's provided them to send them to them in the initial email. They'll receive those PDF links either way, but you can send them to them in the email. So there's a lot of new features, things that we've kind of added out here for easy use for you and your member. Just just kind of keep in mind that, to just get out here and play around. I mean, these things that I'm showing you here right now are live. So if you're not using some of these features, you can go out there and do that just now. Some of the things that I've been getting questions on here lately and some of my other trainings, I'll go through here at this time, and I keep in mind we got about 8 minutes left. So if you guys have questions, put them in the chat box so that I can answer them for you. But just like last year, each carrier is, and I get these questions pretty often throughout the year on, why does this carrier why does this carrier offer an option to enroll into let's say an optional supplemental benefit, and this other carrier does not? It is contingent upon the carrier. If they agree to be on our platforms, including Connecture, that they go through a process and then they provide their enrollment forms to us, Cornerstone, and to us, I guess, Medicare Center team and Integrity, not to me personally, but they tell Connecture basically what they're going to make available through these tools. So if something's missing, it's not because we haven't asked for it or we don't want it to be on there. We just, we asked the carrier, what they, the carrier basically provided us what they wanted to have on here. So if the forms look a little bit different in regards to the questions asked, that's on the carrier. If some offer optional supplemental benefits and some don't, that's on the carrier to make that decision. I will tell you, I'm very excited. I haven't gotten final confirmation on this either, but for those of you that use those VBEs or value-based enrollments, health risk assessments, whatever you want to call them, when you're enrolling your member to get additional commission or those kind of spiffs for enrolling your clients and having them complete some of those questionnaires, then I got some good news for you. Currently, if you use our tool to enroll into Humana, you can still go through their process to get that $50, which is I think what theirs is $50. And then I also have pretty good confirmation that Aetna's value-based enrollment is coming to our tool. So before it was only available through Ascend. I'm being told that is more than likely going to be available. I don't have final confirmation, but I have strong indication that it is coming. So it's going to be, that'll be a good addition to this tool, so that you guys can take advantage of those VBE dollars, basically, if you're using Medicare app and Medicare Center to enroll your members. I did have a question come in. Will non-commissionable plans, MAPD or PDP, still hide under show non-licensed plans, even if licensed with a particular carrier on that carrier's plans that are non-commissionable? The answer to that, Bill, is yes. So the enrollments are going to be disabled for those non-commissionable plans through Connecture again this year. It's my understanding. So if you want to see those for quoting purposes, you do have to click that link. Show non-licensed plans. I understand how some of you guys wish that some of that stuff was activated. I know, like last year, I was getting that question a lot. I believe it was on the enhanced plan and stuff like that with Anthem's PDP, which by the way, if you didn't know, that plan is being mapped to the Plus plan this year. There's also some plan mappings for the WellCare PDPs. So if you need more information on that, reach out to me after this, or reach out to anybody here at Cornerstone, and we can kind of help you answer those questions of how you might be impacted. But pulling it back into this question, if a carrier makes a plan non-commissionable, it's not that it's not in the system. It's that we the enrollment is disabled, so you do have to find that to quote it through the non-licensed plans. Any other questions from anybody else that's still on here? The process is still following up with status on these enrollments that you do through our platform. Will continue to be that you have to follow up with the carrier. Me and my team are here to help as well. If you ever have any issues, finding status, we can certainly help in that regard. We have that Medicare apps at cornerstoneseniormarketing.com email address where you can send some of those things to, as well as our service box service at cornerstoneseniormarketing.com, and the next available members will help you if you're looking for that. So, okay. Well, I'm sorry. I know I didn't get to Medicare Link. As I mentioned, I don't know if any of you guys listening in are Medicare Link users, but that quoting, the client management tool in the dashboard from Medicare Center is where you're going to see the bulk of the changes for 2022. If I learn of anything else over the next couple weeks as they finally put in final confirmations and implementations for new things for 410.1, I will be sure to share that on future trainings. So I did get the thing, is there a summary of apps submitted? So there will be a summary under the client management and quoting and enrollment tool that's coming, Steve. Under that dashboard, you will be able to see a summary of all those apps submitted. Now, if you're using Medicare app, the best way that I've found to find a summary of all the applications that have been submitted, and I kind of referenced it in my, when I was talking earlier, is to use these application end dates. So why don't I just use, like, I didn't submit any enrollment, so it's not going to matter. But, I would use, like, maybe you can, as you're going through here, inside of AEP, you can use these application start dates and end dates to search all the profiles, and it'll tell you all the profiles that you created enrollments on for this tool. So that's really the best way that I've found to get a summary of the applications through Connecture up to this point. Are most companies making the EFT option form available this year? So that's a great question again, Bill. Now, once again, it's contingent upon the carrier when they submit their enrollment forms to tell us how that they want to receive that billing information. So I know that we had an issue with, I believe last year when we first rolled it out was like with WellCare, or maybe that was 2 years ago now, and they kind of disabled their EFT option. And so if they can't receive the information, how it comes over into their systems, then a lot of times they'll make that EFT option unavailable. These enrollments aren't sent over necessarily real time. They're sent over as one big electronic data enrollment file at the end of the day, and that includes any information that's included in the application, like EFT information, banking information, so on and so forth. And sometimes if that's not enough for the carriers, or they don't have the mechanism on their side to ingest all that information appropriately, which is what was causing problems, and so it was just disabled. But I hope that all of that has gotten resolved. Most of the carriers that we had problems with, I will tell you that both me and my team here at Medicare Center, along with Connecture, voiced our opinions on that, and I sure hope that they fixed it. So here's the hoping. But I will see all of the answers to all of these questions in regards to the enrollment forms once it goes live on 10/15. So 10/1 is when you'll see changes to the systems. The enrollment options and enrollment forms for 2022 will not be live until 10/15. Just once again, for compliance purposes, we're not going to allow you to use the tool to apply early. All right, a lot of good questions. Thank you guys for being interactive on this, giving me some feedback. As I mentioned, as I get more information, this training, a lot of it will look very similar as I go through, either my face-to-face trainings or my subsequent webinar trainings throughout the month of September. Here I got at least one a week between now and October 1st. But if I get more information, if I get access to the live environments, to some of these new tools, I'll be going over it on future trainings. So, feel free to pop in on future ones as well, just to see if there's anything new that I can show you. especially as we get closer to 10/1. I anticipate having some more assets and tools available at my fingertips. But, with that, we're already over time. I will go ahead and close it down, give you guys the rest of your Friday back. You enjoy your Friday, enjoy your weekend, be safe, have a great AEP. Thanks for your time, and we'll talk soon.